Okay, we're going to go ahead and just get started for the sake of time. I want to thank everyone for joining us for our Strategies for Effective Fundraising webinar. We have an awesome set of panelists today, so I'm going to go ahead and just remind everyone that if you have any technical concerns and you are able to log on but are having trouble on the audio, you can feel free to message me in the chat to the Global Genes host. If you're having trouble connecting in or you get dropped out, feel free to also email me. My email is ashleY@globalgenes.org, and I'd be happy to help you. So we're going to go ahead and just pass it off to Danny to get us started.
Actually, I want to welcome all of you to this Global Genes webinar on leveraging, on strategies for effective fundraising. I'm Daniel Levine, principal of Levine Media Group and host of Global Genes Rarecast, and my pleasure to be moderating today's panel. We've got two great panelists today who have frontline experience doing fundraising for rare disease organizations, and they're going to share with you their insights from their experiences. Our panelists today are Lindsay Groff, Executive Director of the Barth Syndrome Foundation, and Rebecca Davis, who has consulted to rare disease organizations on fundraising. So, Lindsay, thank you both for joining us. I'd like to thank our sponsor, Genzyme, for its support for today's webinar, and the staff of Global Genes, and Ashley Yee for her great work putting together and coordinating today's program. This webinar is meant to be interactive. I encourage people joining us today to the live chat at the bottom of the screen. It will instant messages questions as we go, and I will try to work through these and work them into the discussion or save them up for the end, and we'll try to do our best to get to all of them. Today we're discussing fundraising. While people like to focus on helping patients and advancing research, it's fundraising that really enables all of the good work that rare disease groups are able to undertake. For today's discussion, we asked Lindsay and Rebecca each to begin with a presentation, and with that, let me turn it over to Lindsay. Lindsay? There.
Yeah, can everybody hear me? Okay, great. Let me step back here. So thanks, Danny, and thanks to everybody out there listening. I want to start by telling you that everything I've learned about fundraising has been trial and error while on the job as Executive Director of the Barth Syndrome Foundation. And I'm about to share works well for our rare disease foundation, but it's not a one-size-fits-all approach. I can learn a thing or two from my example, so feel free to ask questions along the way. Reach out to me by email if you think of something after we're done today. Experience in rare came when I was working as an executive director at an association management company called Fernley & Fernley in Philadelphia. In 2009, I became pregnant with my daughter, seen here in this picture. And during the pregnancy, I found out that she had a rare birth defect where her abdominal organs were outside of her body. It's called involucral. So she was born, she fought for her life to survive, and happily, I can report that she is now a healthy, smart, and beautiful 6-year-old. But that experience forever changed me. While I enjoyed my work at Fernley, I felt compelled to be in an organization with a mission that was closer to my heart, help other families that felt a similar heartbreak from having a really sick kid. And that's when I saw the post for the Barth Syndrome Foundation. I'd heard of Barth Syndrome prior to seeing this job posting. How rare it was when I did my research on the foundation's website, that Barth Syndrome affects fewer than 200 living people, known cases worldwide. And it only affects boys because it's X-linked and it's life-threatening. It causes enlarged heart, serious infections, and muscle weakness. As you can imagine, it can be really tricky to diagnose given how rare it is. And when the parents finally find us, they're usually desperate for answers. And that's where the foundation comes in to help. So this is a little bit about what our foundation does. It sends the money that we raise twofold, for a twofold purpose. We fund research and we support families. To get started on all of the fundraising details, I wanted to show you our revenue history here. So can see that revenue was already pretty impressive when I came on board in 2011. Remember that there are fewer than 200 people that we know about worldwide, so it's not an easy task to ask for money when not many people have even heard of Barth syndrome. When you're looking at this, you'll see a pretty big spike in last year's revenue. And while we're celebrating that, it's also bittersweet because many of those large donations came when one of our beloved boys died. It was Will, and he was really near and dear to my heart and so many others. People gave in his name so his memory could live well beyond his shortened life. Okay, so this tells you what I knew about fundraising before I started with BSF. Let's flash back 5 years ago when I applied for the job. I knew basically nothing about fundraising. In fact, I almost didn't get the job because of my lack of experience in that one area. I was pretty naive back then, and I thought that my MBA and marketing degree would translate into these great skills to help me raise money. I had to run a nonprofit, but I never actually had to do fundraising for any of my other groups. So the board took a chance and hired me anyway, and they even set aside a large education and training budget and promised to support me in my efforts, and I know I was really lucky to have that. I did everything I could to learn how to raise money. I attended webinars just like all of you are doing today. I read articles. I even went to a week-long course at the School of Philanthropy in Indianapolis. Learning on the job, I still made tons of mistakes along the way. Mistakes that I am even embarrassed to admit to the real development people in quotes, on the call today. But I am going to cast aside my embarrassment, and I hope that by sharing my blunders, you can learn from me and perhaps avoid making some for yourself. Some of the mistakes I made. I'm sure there are so many more, but given that we have limited time on the call today, thought I'd limit it to about 6. You can see them here on the slide. I'll go into more detail for each of them, along with the steps I took to correct them. So into the details here. I know I'm going fast through the, you don't have to remember all this because I'm going to go through to each slide. Will have 1 line to the 6 here. Okay, so first, let me tell you about my writing style. All my writing experience in college and in prior jobs was more for the business world, and it was all very proper and very professional, and it was filled with jargon. So to basically unlearn business speak and instead try to talk to donors like I was talking to a friend, like a conversation, and it was awkward. As I was making this change with myself and with my organization, with the Barth Syndrome Foundation, I got tons of pushback from my board, from my volunteers, from my staff. So I was following the industry best practice of writing at a 6th grade level, but people were used to the old way. They told me that I was talking down to people. They said our donors were different. Our donors are so highly intelligent, and there's no need to dumb it down for them. What I did was I stopped sharing my appeals with my publication committee. I stopped asking for opinions and feedback, and I just relied on what I learned from fundraising experts. I trusted my gut, and I just went with it. So I will tell you some of the things I learned along the way. And the best tip is one you've probably heard before, and that is to use the word you more times than you use the word I when you write to donors. And that's because appeals are more about what the donor wants and not about what you want. They want to help solve problems and want their contribution to be recognized. So a phrase that I commonly use in my writing is, you can make a difference, or you can help. Also, writing to donors is not the place to show off your fancy vocabulary, even if you have one. And it doesn't mean they aren't smart enough to understand. It just makes it easier and faster to read and comprehend. We're all so busy and so distracted with our lives. Simple writing can get the point across faster, and it doesn't make your brain hurt. For example, someone once told me, so don't use the word utilize, and you could use the word use. Just simple. Also, if you want to give your text some breathing space, you can increase the white space. It makes the text pop and grabs the attention more easily for the reader. Bullet points and bold text used sparingly work well too. And with your letters, I like to tell people that I think about how I would talk to a friend or even a kid. So it's helpful to have a 6-year-old, although they say a 6th grade student is the best way to reach. So when I look at this, I think about handing it to a 6th grade student and think, would they get the gist of this? Would they kind of understand what I'm saying here? And if not, why? And my final tip, which we have entire conferences dedicated to, is telling a story. So when I'm sitting down to write an appeal letter, I always tell the reader about one boy and problem that we need help solving. I use descriptive words to help paint a picture of what it's like to have Barth syndrome. I have a sample appeal here at my desk, and I won't read you the whole thing, but I'll read you just the first few lines to give you an idea of what I mean. And this is an appeal about a little boy named Connor. So it says, a mere 5-year-old standing at the edge of your driveway, look at his cousin zip by on their bikes. Your child just watches patiently until he tries to chase them, but can't. He doesn't have the energy. What do you say when your son asks you, why can't he ride a bike? Promised his son, Connor, that he would do everything he could to make sure that he could ride his own bike one day. You could help Connor, too. But this letter is of course, we have photos, and you can't see that right now, but I'm happy to send you what it looks like if you ask. And there's a picture of cute little 5-year-old Connor, and imagine that he can't ride a bike, but all the other kids can. Let's go on to mistake number 2 here, and this is probably the silliest rookie mistake that I made. When I sent my first direct mail appeal, it was written well, but aside from that, I actually sent it without a return envelope. That means that even if donors were moved by my probably mediocre letter, what are you supposed to do about it? They had no way to send a check. So if someone asked you for a donation and then you had to go find an envelope and address it and remember the address and where it was supposed to go, it might not sound so bad, but when life is busy and hectic like all of ours, it's just another barrier that we should be removing to make donations easy. Easy is always the number 1 priority. So we redid our remittance envelopes with photos, and we used quotes from the boys, and we allow people to donate by check or credit card using that envelope. And since we have so much required language for raising money in different states, as many of you might, we actually tuck that information in the inside of the envelope. And that's legal and totally allowed, but it doesn't take up the precious real estate that you need to, give the necessary information to your donors. And if you want a sample of that, just ask me and I'll send it to you. Okay. Another rookie mistake was I confused a digital online campaign with direct mail. So I was really excited about Giving Tuesday, so excited that I didn't think about which method to use and which one would work best for this unique event. For those of you that don't know already what Giving Tuesday is, it's considered this global day of giving, and it's after Thanksgiving, at least here in the U.S. So it's like this. It's Thanksgiving, Black Friday, now there's something called Small Business Saturday, and Cyber Monday, and now we have Giving Tuesday. Now, thinking about how I sent a postcard to our donors about Giving Tuesday. And so what? Like just like I got the envelope with my first appeal, how are they supposed to give with this Giving Tuesday postcard? There was no way to take action. So now we do this campaign totally digitally, in a digital way, and we use social media. Mostly use Facebook and some Twitter. And it's pretty simple. So I'll tell you about what we do, and if there's questions about this at the end, just let me know. So we start by telling our affected families, remember there are so few of them, so we know them all by name. We start with them and we tell them about Giving Tuesday. We tell them what it is, the date, our goal in fundraising, and what we want them to do. Probably the best example of how we use our small size to our advantage. Like I said, we know them by name and we know how to reach them. So I'm a volunteer who creates an image of every affected boy in the U.S. with a link to a donation page just for Giving Tuesday. And we ask the families to post those images to their Facebook page on that specific day with personal asks. It's like sending out this army of grassroots fundraisers. To give you an idea, if someone has 100 friends on Facebook and 10 of our families participate, that's 1,000 potential donors reached on one day. Utterly painless to donate online through this custom event page, and we use Bloomerang as a donor database that allows us to do that. It's 30 seconds to make a credit card donation. And that way we make sure to tell everyone that we have a goal and a generous matching gift, again, only on one day. We tell our people that we are looking to raise $10,000 in one day in order to receive a $10,000 match from a generous donor. Last year, we raised over $25,000, and we got the $10,000 match, which brought us to almost $6,000 raised in one day. For a small group, that's a lot of money. Thank you letters. Here, this will be funny to some of you. When I first started with BSF, like many letters that you may have received, they were fairly boring. There wasn't anything technically wrong with them, but they weren't exciting, and they took way too long to get to the donor. They had the necessary details for the tax receipt, but they weren't warm or significant really in any way. Now, the way we do it is another way we use our size to our advantage. So when someone gives us a gift, we customize that thank you letter with a photo of the boy that inspires them to give. Our database tracks each donor connected to a solicitor. Families are the solicitor in almost every case. Since we're so rare, every donor is connected somehow to a boy with Barth syndrome. So when we thank them and they get that letter in the mail, they see a photo of the boy that they know and love with their name on it. Like I mentioned with that appeal that featured Connor, we can use the photo of the boy that was used in the appeal so they can get a thank you with Connor's photo on it, a different photo. Donors have actually taken the time out of their busy day to call me and tell me how meaningful it was to see a photo of the boy that they know and love on that letter. And they know how to call me because my cell phone number goes on every thank you letter. And that's just something else that can't happen when you're with a larger organization. Now to the annual report. When I first started, again, with BSF, it was about 44 pages long, and if I'm honest, the text was long-winded. It's just its purpose, kind of like our thank you letter did, but it wasn't memorable, and 44 pages is just too long. So now it's 16 pages, and some people actually consider that quite long, and they'd like to get it down to 4 pages, or some I've seen as a flyer with only 1 page, which is pretty amazing. But hey, we're making strides from 44, so I'm happy. On the cover, which you can see here on the slide, it's a really large image that in and of itself tells a story. You sit there and you wonder, who is this boy and what procedure is he getting done here? And notice that he's not smiling. We intentionally so that the donor can sense that there's a problem to be solved. Because what I learned is when you show happy faces, it leaves the donor feeling that all is well. And I can tell you that all is not well when you're suffering with Barth syndrome. On the side, Aiden's mom, who's on the cover, Aiden's mom talks about what it's like to have a boy with Barth syndrome and how her family suffered the loss of her brother who died when he was just a baby, also from Barth syndrome. Goes on to talk about what the foundation means to her, and she directly thanks all our generous donors. Okay, where the big bucks come in here when we talk about major gifts. The money that we raise comes from major donors. For a small group like BSF, we consider $1,000 or more a major gift. And long before I came into the picture, this is how the organization raised money through personal relationships. So it wasn't BSF asking, from an appeal from the foundation. It was actually our founding board members, and long before we had staff, we had volunteers. And we still rely very heavily on those relationships, but we've added structure now. Look at the image on this slide, and you'll see a little snapshot of a spreadsheet. And this is totally stolen from Veritas Group. If you don't already subscribe to their blog, it's called Passionate Giving, and it's tons of useful information. And this is something that they talk a lot about. They call it the MIC, the Marketing Impact Chart. What we do is we take every donor that's given $1,000 or more, and we put them into this simple spreadsheet. Then we remove anyone like a one-off donation that we're fairly sure won't give again, someone who's deceased, or whatever subjective and we don't feel that they qualify as a major donor. After we reduce this list to about 150 or so, we rank them by A, B, and C, based on what they've given or what we think they're capable of giving. Anyone who has given or can give $10,000 and up is an A. Anyone who's at $1,000 is a C, and in between are the Bs. Then we have a plan for each of those donors. The C's are basically all the same, but B's and A's get more attention. They might get an in-person meeting or a handwritten note, or something I really love to send is a handmade card from one of our boys. So on the spreadsheet, we have their name, their ranking, like the A, B, or C, a donation goal for the year, what we think they can get based on history and based on their ability from our research, as well as a touch point for each month. And it's not always an ask, of course. Most of the touches are ways to keep the donor informed or to thank them. And we'll play with whoever brought them in to ensure that we are making sense with the way we're asking people and giving any personal information we need to know. This plan helps us project revenue more accurately than we've been able to do in the past. So all of the mistakes and everything I've just shared with you, including some of the best practices, I learned from a variety of sources. And here's a list of some of the really smart people who helped me navigate fundraising as I was learning and continue to learn. I encourage you to check out the website when you have time. So that's it for me. Back to you, Danny.
Lindsay, that was great. You mentioned that you learned from these professional fundraisers. Did you hire them as consultants or pick their brains casually?
So actually, we didn't have the budget to hire experts. So like I mentioned, I attended webinars. It's amazing when you attend a webinar and reach out to people. They're just like us, and if they have the time, they'll answer you as long as you're not asking them a barrage of questions. Reading books and asking questions, webinars, and all that is how I did it informally.
One of the things you and I have talked about is the importance before going out to raise money of having your house in order, the importance of professionalizing your organization and making sure your materials and website and other things reflect that. Tell why that matters and what you did to get there.
Sure. So the way I think about it is donors have an infinite amount of choice when they decide where they'd like to give their hard-earned money. So assuming you have this great story and you've hooked them with that story, they are still going to want to feel confident that you're going to do good things with their money. So some of the things that we've done is we're a member of the National Health Council, for instance, and they have standards that you need to meet to be a member. And we also make sure that we continue to get good ratings with all the charity watchdogs. We put all those badges and displays of all the things that we've, earned or members of on our website, right on the donation page. And as well as we put all of our finance information, legal documents and policies in the most transparent way that we can think of. And all that's right on the website. So we've been told that it's easy to find and people feel comfortable after they, kind of do their homework that it's safe to give with us.
Of the small size of your patient population, because this is not a well-known disease, strategy is very dependent on going to a network of people who know actual patients and relying on members and families of people with the disease to really go out and connect you to potential fundraisers and do the ask. Is there a barrier you have to help these people get over in terms of not only talking about their child's illness, but in asking people that for money?
Well, what we've found is, I don't know if it's because we're so rare and people feel like they're part of this family when they finally find us, but what we found is people are surprisingly willing to help. Not all of them, but what we do to make it even easier is to make it as painless as possible. We have a toolkit, answers any common questions, and it's kind of like a how-to document for all types of grassroots fundraisers. So people have given us great feedback on that. It kind of takes a lot of the anxiety out of it when they see, oh, there's a whole kit here, and I could do this. We give them ideas and go about doing all types of things, from walks to bake sales to golf tournaments and things like that. And once someone does it, which we've been so blessed that even long before I came along, our families were doing fundraisers, we as a staff reach out to them and encourage them to talk to other families about how easy it was, how much money they raised, how good they feel, and ask them to post that on our listserv and social media. One thing for me as the executive director to ask, or one of our staff members or even a board member, but sometimes when it's like mom to mom or dad to dad, it's fear because they can tell you, oh, I did that and I was scared too, but it was easy. And like I say, even in asking a donor, just like you don't if you don't ask. So we ask and we make it part of the culture so that people feel comfortable. And not that it's expected of them so much, but they see other people doing it. So somehow it's kind of just woven into what we do at BSF.
Reference to a database earlier, and we did have a question from the audience about what specific database you were doing, but I'm wondering if, in responding to that, you could also talk about the importance of getting data and building data and using data.
We use Boomerang, it's called. It's like Boomerang with an L in it, Boomerang. And they're relatively new. They offer a product that once I saw it, I just couldn't refuse. I did a lot of research by asking a lot of other groups what they were using. And there's some good solutions out there. Some of them are very expensive. Some of them I found to be kind of clunky. And in my experience with Boomerang, it felt like when I was using a BlackBerry and then I got the iPhone, how it just was super user-friendly and everything seemed so cool and new. It's really innovative, and we've been really happy with it. So it was like changing any database from one to the other. It had its challenges. As they say, garbage in, garbage out. So there was a little bit of a learning curve getting all the old stuff into the new place. But now that we've got it up and running, it has the ability to pretty much do anything you want it to do, and we add on to things we know. We track every time we send a newsletter. We track if that was what made them give. We track appeals using codes, and we have a lot of different reports that we can pull from that data.
About Giving Tuesday earlier, I'm wondering, though, if you can talk a little about social media specifically. Do you use social media outside of Giving Tuesday, and so how important is that, and if not, why not?
I might be an outlier here, but we do social media, but it is not the big thing that we concentrate on. For us, we are very focused on direct mail, which, according to a lot of the research, is the best way to raise the most money. And social media is certainly hot, and it's kind of sexier and exciting, and we use it. The most targeted way that we do use it is on that one day with Giving Tuesday, which is an event that people are getting more and more accustomed to. And we use it in other ways where we're giving updates. We very rarely do direct asks as far as fundraising. It's more of cute, thoughtful things like for Father's Day. It didn't have anything tied to do with an ask, just thanking the dads out there for all they do for our great kids, things like that.
Well, the other things you say you don't do is events. What do you mean by events, and why don't you do those?
We don't do events in the traditional sense, but we do have a conference, and that raises money, about $60,000, and that is nowhere near covering the cost because it's not technically a fundraiser. It's just a great opportunity to ask people for money for something they're doing anyway. We don't do galas or anything like that, any black tie or anything. And the reason is there is a tremendous amount of staff time needed, resources that we just don't feel that we can allocate for events like that. We don't have the resources, and in our experience, again, for our group, we just don't feel that they're worth the investment.
I want to remind our audience that they can instant message questions they may have for our panelists as we go, and we'll try to work them into the conversation as best we can, or save some time at the end to ask them. Let's turn now to Rebecca Davis, who has consulted on fundraising to rare disease organizations. Rebecca, please tell us about yourself, your work, and what you've learned fundraising.
Sure. Well, let's see. Am I driving the mouse?
Ashley,
I will
okay.
switch it over to you.
Great. My story has some similarities, and I want to echo some of what Lindsay just said, but I also want to talk about a couple of fundraising strategies that Lindsay didn't mention, and I want to try to fill in behind a little bit with a little bit of information from the perspective of a professional fundraiser about why some things some things matter. I am a professional fundraiser. I've been fundraising professionally for more than 20 years now, but I've been fundraising actually much longer than that. I got my start at the age of 8, and this is actually a picture of me when I was about that age in Brownie Scouts. I currently work for the Girl Scouts, so I love this picture a lot, but I have worked for PeertoPeer Foundation and a number of other health-related causes, including the Alzheimer's Association, the National Down Syndrome Congress, and the Spina Bifida Association. So I've worked with a lot of health-related causes. I love to tell the story of my very first fundraiser because it illustrates something that Lindsay also said, which is that fundraisers aren't born. You don't automatically know what works in fundraising. When I organized my first fundraiser and I was about second grade, I got the neighborhood kids involved, and we did this big circus in one of our backyards and charged our parents admission, and we had acts on the swing set like the trapeze and the trampoline. We raised probably a whole $13.86. So my fundraising career did not get off to an exceptional or stellar start. It's something I learned over time, and I learned in many of the same ways that Lindsay mentioned, and I'll elaborate a little bit on that in just a few minutes. But I like to tell that story because the good news and the encouraging thing that I can say to each of you is anyone can become a fundraiser. You know, if you have an interest in fundraising, if you have a passion for a cause, you can do it. It's not like something that some people automatically know how to do. I did work for PeertoPeer Foundation for about 2.5 years as a consultant, and I helped them do a number of different things, including start a major gifts program, worked very hard on their donor database management, creating some protocols for the database and how things went into the database so that they could be retrieved in a systematic way and help inform strategic and fundraising decisions. I also helped them develop some donor relations protocols, and with those protocols we worked on thank you notes in particular, and Lindsay mentioned that a few minutes ago, and I just can't emphasize more strongly how important it is that you thank donors very, very quickly. The industry standard that is called for is actually within 48 hours of receiving the gift. You have to thank donors quickly and sincerely and appropriately, and you know, hopefully creatively, and not just a thank you for your gift note. I also did a couple of things for PeertoPeer that were really fun and also helpful in terms of I wrote and designed some kits, some toolkits for people all across the country who were impacted by juvenile myositis and who wanted to raise funds to help put tools in their hands so that they could fundraise. PeertoPeer itself, a lot like the Barth Foundation, didn't engage in big fundraising events for a lot of the same reasons, but we did encourage the people who were a part of our network to host events themselves. And so many of the families that we served will put on a 5K or a silent auction or some other event. And so we made toolkits on how to run a golf tournament, how to plan an auction, how to do a jogathon, sorts of things to help our volunteers be able to fundraise for us. And one of the other things I did was to help them with their communication with peer-to-peer fundraisers, and to help develop some tools for peer-to-peer fundraising. And if I will come back to that in just a moment. Just to let you know what juvenile myositis is, if you're not familiar with it. I know I was not familiar with it before I went to work for the organization, and I went to work for the organization just because I'm a professional fundraiser, and they placed an ad in some periodical that I read at the time, and I applied for the position. So, I went into the disease cold and didn't really have any personal first-hand knowledge of the disease, but instead I had the fundraising skills. And that can actually work for an organization. I know a lot of people, particularly people who are deeply affected by a cause or a disease or an illness, might think that the only people who can fundraise and care enough to really make a difference are people who are personally affected, and that's just not true, And over the period of working with CureJM for 2.5 years, I will tell you that I came to care very deeply about a number of the people associated with the organization and with the cause, and I will care about them always. But juvenile myositis is an autoimmune disease, and in juvenile myositis, the body's immune system begins to attack its muscle and skin tissue, and the disease can, you have muscle and skin tissue throughout the body, so it can affect basically any part of the body. It can affect any organ. It can cause heart failure or weakness, muscle weakness. And only about 2 to 5 children per million each year are affected. So there are about 17,000 children across the United States who are believed to have juvenile myositis. Like all rare diseases, it's relatively unknown. People haven't heard of it. It doesn't impact large numbers of people, and that can be really challenging because if you go to put a proposal before a corporation or a foundation, a grant funder, oftentimes they want to know how many people are going to be impacted by their dollars if they give. So, and with Alzheimer's disease or Down syndrome, I have fundraised for causes like that. I can start conversation in a different place than I have to start the conversation if I'm fundraising for a rare disease, because when fundraising with a rare disease, you have to start by explaining the disease. Whereas with Alzheimer's Association, everybody has at least a rudimentary familiarity with the disease. One of the things, when I first went to work with CureJM Foundation, they were really concerned that they couldn't effectively fundraise because of the small numbers. And I said, well, don't focus on the numbers. People get overwhelmed by large numbers, and numbers are very, very abstract. What you do have going for you and what you need to focus on in your fundraising efforts are the stories of the individuals that are affected by the disease. It's really important to put a face on the story and to give your constituents tools to tell their story. And that might be a sample template of how to tell their story so they can tell it on social media or tell it on their blogs or tell it in their community when they're trying to ask businesses that are familiar to them to support the cause, but to give them tools to tell their story, because their story is the single most powerful thing that they have. There's actually a wonderful research study in fundraising that shows that when there was a test of a direct mail appeal, and some people got a letter that said kids are starving in Africa, and other people got a letter that said Rokia is starving in Africa, and told the story of Rokia. Well, as you might imagine, the appeal that focused on Rokia raised so much more money than the appeal that focused on the millions of children. So you don't actually have to have the numbers. You just have to tell your story really, really well. And while it is challenging sometimes to approach corporate or foundation funders, start with those that you know. Your volunteers, where do they work? Where do their parents work? You know, where do your patients, if they're not minors, where do they work? What businesses are known to you? Do you have connections at? And who knows somebody at the community foundation or at a foundation attached to a corporation? And, you know, if you ask cold, and this is actually not just true of rare diseases, but of fundraising in general, you know, cold asks are challenging, and it's difficult for anybody. And I think it's a little more difficult for those representing a rare disease, but still, it is difficult to make a cold ask. So go where you have relationships and where you are known, and start there to make asks. I would encourage you to not really even focus on chasing grants or corporate dollars. Grant funding has become incredibly competitive. It's on the decline. Well, I don't know that it's on the decline, but I mean it's harder and harder to get grant today than it was 5 years ago or 10 years ago before the crash in 2008. And it is really, really challenging. So it's probably not the best use of your time. And I know most people, when they think about fundraising, they think either grant or event. And that's not what you want to think. You want to think instead about who you're closely related to. There's a principle in fundraising called LAI, and that refers to linkage, ability, and interest. And the linkage is who we're connected to, the ability. Lindsay touched on a few minutes ago when she talked about her ABC ratings, you know, who's capable of giving more. And the interest, you know, has anybody that you want to approach shown any interest in your cause or your disease? And it doesn't necessarily mean that if they haven't that you can't approach them. It just means that the people with the highest linkage, the highest ability, and the highest interest levels are your best prospects, and they're the people you should ask first. And that's why when you say to a fundraiser, oh, we should just ask Oprah, you know, I think all fundraisers kind of roll their eyes thinking, you know, Oprah has no linkage or interest in us right now, and if we're really lucky, we might be able to develop that, but chances are we're not going to be able to develop that. So we need to instead, you know, a better prospect than Oprah is somebody who's close to us, who maybe isn't as wealthy as she is, but is still close to us. And here, peer-to-peer fundraising, this is one of the things that I wanted to share with you that has worked really, really well over and over and over again for CureJM Foundation and for a lot of other organizations as well. But I think it's a great tool for those in the rare community, because what this is you as an organization do not actually make the ask. You don't actually request funding from people. What you do instead is you give tools to the people who care the most about your organization and ask them to ask. Because I'm only, you know, if I think about linkage, ability, and interest, I'm only linked to a certain number of people. Well, if I get the people that I'm linked to through the organization to connect to the people they're linked to, then we multiply the number of people that we can reach and that we can ask. And peer-to-peer fundraising, if you're not familiar with it, is also called crowdfunding, or you know, people do things like the Indiegogo or GoFundMe. In fundraising, it's more common than using Indiegogo or GoFundMe, which people are more familiar with, to use things like CrowdRise, First Giving, Classy, or Razoo. Those are platforms, computer software platforms, that allow your donors to sign up. And once they sign up, they have a page, and they can post their page on Facebook, for example, on social media, and say, hey, I'm raising money for to cure juvenile myositis. Could you please donate to the CureJM Foundation, and they link people to their fundraising page, or they send an email out to ask somebody to give. This has been phenomenally successful for CureJM. They have actually won the CrowdRise Holiday Challenge a couple years in a row. They've either had first or second place in the last several years, and they have done that by rallying the people who, the families of children who are affected by juvenile myositis, and getting them to sign up to raise funds through the CrowdRise platform in this contest. And then they've not only gotten the money they've raised, but they've also won cash prizes. And in one year, the cash prize was $100,000. Another year, it was $60,000. So it was well worth CureJM's time and energy to mobilize the troops for that. And that's one way that I'll say that even though CureJM, like the Bach Foundation, has elected not to do big galas and those sorts of events, CureJM also does an educational conference. And one of the smart things, and CureJM does a lot of smart things, but one of the smart things the organization does is that it plans its educational conference to be held in a city where a running race is already being organized. And then they use a peer-to-peer fundraising platform to allow the people who come to the conference to also sign up for the race and fundraise while they're doing it. And each year they raise several $100,000 through a race. And the great thing is, unlike other events, they don't have to plan the event. They're already being planned. They just have to motivate their friends and family to register for the event and to fundraise for the event, but they don't have to themselves actually organize the race. It's already done. So that's a great way to capitalize on races that are, to capitalize events that are already being done by other people, which keeps you from having to do that. One of the final things I'll say is that nationwide and actually globally, we know that in fundraising, the rate of donor retention is extremely low. And in fact, the most recent studies show it at about 39%, which means that 61% of all the people who donate to you for the first time this year they'll never donate again. So donors are really, really hard to retain. Keys to retaining them are through what fundraisers call stewardship. And by stewardship, I mean the thank you note process, which we talked about a few minutes ago, but also other ways to appreciate and acknowledge your donors. And that's why a lot of organizations do donor lists in the annual reports, because that's a form of acknowledging the donor and the donor's gift. You might do plaques, stick places, or name things after a donor, or do other things to acknowledge a donor. And I know most donors say, no, I don't need that, I don't want that, but the reality is they do that, even if they don't necessarily acknowledge it. And so it's important to acknowledge your donors, show them appreciation. And finally, also, by the word stewardship, I mean report back to them. Tell them how their gift was used. If you have a donor that gives, particularly if they give for a particular thing, for a research project, for example, get back to them and tell them what came out of that donation. What did you learn from that research project? Or what did you, how did people benefit from the conference that they funded? They really want to know that. They want to know that their dollars made a difference and did positive things. So with that said, Dan, I will pause, and I'm happy to answer any questions that people have on their minds.
Great. Thank you so much, Rebecca. That was great. Wondering if you could talk a little about the importance of stewardship and what you mean by the term stewardship. What does that entail, and why does that matter?
Sure. Stewardship, one of the reasons it matters, and when I say stewardship, usually I'm talking about appreciation, acknowledgement, recognition, as well as faithfully using donors' gifts in the manner that they were intended to be used, and reporting back to the donors on what happened with their dollars. So stewardship is a broad concept, but one of the things that the research on retaining your donors shows is that stewardship is the best way you can retain your donors. If you can do a really good job, especially of the thank you process. And I know we think of the thank you note as low priority or something we can get around to. We procrastinate on thank you notes. But actually, it's one of the most important things. I would argue that how you thank a donor is more important than how you ask a donor. And so it's just really, really essential to get that thank you note out right away. And it's okay to thank donors more than once. Multiple thank yous from different people. Are really, really beneficial. There's one study actually that suggests that if you get your board members to call a donor to say thank you, that donor is 39% more likely to get again than somebody who didn't get the call from the board members. So, if you have really big gifts, major donors, when they give, get your board member, your board chair, another board member to call them up and say thank you.
One of the other things we've talked about is the importance of learning about your donors and your potential donors. There's a lot of data out there that people may not be aware of. I'm wondering if you talk a little about how you go about learning about a potential donor before reaching out to them or meeting with them, and what kind of data you try to gather.
Sure. One of the things you and I spoke about, Danny, was about the fact that CureJM, in order to begin its major gifts program, one of the things that CureJM did was it did a wealth screening. And there is tons of information that is available sort of in the public realm, from tax records and tax documents to information on wills and stock filings, registrations of yachts and airplanes. There are lots of things that are available to the public, and there are actually companies that specialize in combining all of that public data into databases that you can check your donors' names against in order to determine whether or not your donor has capacity to make a major gift. And there are a couple of different companies, three off the top of my head, that are probably the best known for that. Blackbaud would be one of them, Wealth Engine would be another, and Donor Search is a third. It's a cost a couple $1,000 to screen your data, depending largely on donor names you want to check against their database. But it's well worth it. When I was working for one organization, we did a wealth screen of part of our database, and we found a donor that had been giving for, 14 years to the organization and had been giving $35 a year. Well, through the wealth screening process, we learned that this particular donor, who was just one name and of thousands of names that no one in the organization had ever paid attention to, actually had a family foundation, and the family foundation was worth several $1 million. So we began then to treat that donor with a major gifts plan. We began to talk to them, not just through the newsletters we were mailing out, but in other ways. And the year that I worked with this organization, they actually made a gift of $50,000, and I hope in future years the donor will make even more substantial gifts. But here this person was giving $35 a year, and nobody knew to ask this person for more money until we did the wealth screen. So, it more than paid for itself, and I think it usually does more than pay for itself. Then there are the old-fashioned ways, before there were these companies with these mega databases of compiled public information where people circulate names among the board directors, members, and key volunteers and ask who knows whom and what do they know about them and how much do they know about their financial position. And that's one way to go about it also. But if you can invest in a wealth screening, that's a great thing to do.
Let's bring Lindsay back in here. We don't have a lot of time. We do have some questions from the audience, but one of the questions, and you spoke to this a little about not going after corporate donations, but either of you talked about either seeking money from drug companies or seeking money from foundations. Is this something that just isn't worth the effort, that there's, or is it difficult, or why to have strategies for going after that kind of money?
Well,
Rebecca,
go ahead,
go
Lindsay.
first.
I was just going to say, PeertoPeer actually did go after that money, but had very limited success. I think if you have, for example, a pharmaceutical company that has a treatment that is specific to your disease, and the pharmaceutical company is aware of your disease community and, knows that its market is that disease community, I think it's a great candidate for you to go after. Unfortunately, with juvenile myositis, there's no one drug. It's treated in so many different ways, and all of the treatments that are used, for example, a lot of the children get chemotherapy and cancer treatments. Well, cancer-related causes have a whole lot better chance of getting the dollars from those pharmaceutical companies than juvenile myositis did. And because there wasn't a specific treatment or cure, we found that, the only places where we really had success were places where our board members worked or some of our key family members and volunteers worked.
Do you want to add to that, or?
Sure. So I agree with you, Rebecca, and some of the comments that are coming in, it said, I think drug companies, if they have interest, they'll help, and I think that's true. We, up until very recently, didn't even dream of approaching pharma because they don't know who we are. We have such a small patient population, and we thought they'd never be interested. And thanks to all the hard work with funding basic research, we're actually right on the of announcing our very first clinical trial, and that company who is offering the drug gave us a significant donation that we could use in any way we'd like with no strings attached. We didn't even ask them. They came to us. So without having a reason for them to give, my advice would be not to waste your time. And when that moment comes, I think it'll happen naturally, assuming, again, your house is in order and you're a reputable patient advocacy group. It'll probably come naturally, but we did not go out and seek this because we would just be spinning our wheels, in my opinion.
Question about raising money for research in rare diseases, but I'm wondering if the two of you can speak to how specific risk is tied to a use and how you address the issue of raising money for operational expenses, which my sense is donors generally don't like to give for.
Sure. I'll jump on that first, Rebecca, if you'd like.
Okay.
So we're, in the way that we're specific is the way that I told you about how we write our appeals, that we write about a boy and his story, and we usually then say, the way they can help is the money will fund research, and it does. Typically, the money we raise goes either to the general fund or our biggest expense, which is our science and medicine fund. But really, as I mentioned, that we're getting close to these clinical trials, we anticipate that we can now be more specific in our ask. And since the expense will match what we need, in other words, it's how much we need to raise, we don't feel that it's a conflict of taking away from the general fund. Pretty much every appeal that we go out as BSF, we, of course, try to get those funds in the general fund, and however, of course, we'll accept them in a way the donor would prefer to give them. I think that's going to be a shift for us now that we're getting to actual trials in patients, and we probably will get more specific.
Want to add to that?
I would say that, well, traditionally, yes, general operating dollars are the hardest to raise, and donors typically want to know what their dollars do. So, you know, the more that you can tell them along those lines, the better. Some of the general donations that come in from things like constituent fundraising or peer-to-peer fundraising, those are great things to use for operating funds. And Cure.am, like a lot of other rare diseases, was looking for a cure and funding, or is looking for a cure and is funding research to that end. I think one of the things that I helped them understand when I was there is that typically people don't like to give pass-through donations. And what I mean by that is, you know, I think some people think that a foundation or a grantor is going to want to give the organization money to fund research. And that's just typically not the case. Every once in a while you'll hear of a funder with a particular interest who will fund an organization, and the organization will make grants out of that funding. But that's just really, really rare. Usually if a foundation wants to fund research, they're going to fund it directly themselves. And that way they can have more control, they can administer the funds, et cetera. So, you know, to raise money for research, I think the best way is to go to individuals and not to foundations for that kind of funding.
I apologize, we have more questions than time. We've got to wrap here, but we'll try to see if we can answer the questions via email for people who asked questions that didn't get answered. In very short order, there was a question about whether there's a toolkit that exists. I know Global Genes has a forthcoming toolkit on effective fundraising strategies, and you can check the toolkit section of the Global Genes website for that and other toolkits. Let me just ask one final question to our panelists. Rebecca, what did you learn from fundraising that you wish you knew when you began that would have saved you a lot of time and wasted opportunity? Lindsay?
And so many things. I mean, I think I went over all those mistakes I made. I guess the biggest thing is to get personal. I think I was trying to believe that donors were somehow these, you know, they were just full of mystery. But it turns out they're just people, and talking to them in a more conversational, more compelling manner, as opposed to being fancy or using these, you know, big, articulate words. That was where I really went wrong in the beginning. It's more about the story, giving the donor a reason to, they want to give them a reason to give to, and by making it personal, using our size to our advantage, warm and conversational. That's probably the biggest take-home that's helped me along the way.
Yeah, and Danny, before I answer that question, I'm just dying to mention this resource to everyone. Lindsay did mention some excellent experts, all of whom I also follow and learn from, but they all specialize in donor communications and communications. And so I would actually encourage you to go to the website of Bloomerang, and that's bloomerang.co, and not .com, but .co. That's the software that Lindsay mentioned that she uses. Bloomerang, every Thursday, almost all year round, has free webinars on Thursday on fundraising topics, and there's an archive on their website of past webinars that you can hear, and there are all kinds of fundraising experts from all over the world who do these Thursday webinars. And if you find one webinar that's particularly helpful to you, you can search out that fundraiser. And usually often the people who speak on the webinars are consultants, and they have websites with more resources. So I wanted to mention that website. The thing that I think was heartbreaking to me when I worked for Cure.am was just the absence of response of grant funders. I personally have written more than $3 million in successful grants over the course of my career, and I've never been a grant writer. It's always been, you know, just one other thing I did. So, you know, it's not like something focused exclusively on. So that's a pretty good track record for a fundraiser who's not been a grant writer. And so I thought I was really good at it, and I would be able to do it well for CureJM. And just time after time after time being rejected made me realize that it's just probably not the best way to go about fundraising in the rare world. And I would discourage people from spending time and energy or money on a staff person to pursue grants.
I'd like to thank our panelists, Lindsay Groff, Executive Director of the Barth Syndrome Foundation, and Rebecca Davis, who has consulted to rare disease organizations on fundraising, for sharing their insights today. I'd also like to thank our sponsor, Genzyme, for their support of today's webinar, and the staff of Global Genes, and Ashley E. for her great work in putting together and coordinating today's program. Be sure to join us for our next webinar, Keys to Effectively Communicate with Healthcare Providers, which will be held August 9th. Also want to remind our listeners that registration is now open for the 5th Annual Rare Patient Advocacy Summit, September 22nd to 23rd in Huntington Beach, California. This is a great opportunity to learn from other patient advocates and meet people in the rare disease community, and it's a truly transformative experience. I also want to invite all of you to join us for our weekly podcast, Rarecast, which you can find on Global Genes Rare Daily or on SoundCloud, iTunes, or Stitcher. You continue this conversation with us by following us on Twitter, at DS Levine, and Global Genes is at Global Genes. As you seek to learn about rare disease and connect with others, I encourage you to explore the many resources available on the Global Genes website. On behalf of Global Genes, I'm Daniel Levine. Thank you all for joining us today.